The monitor flatlined for the fourth time. Dr. Marcus Chen stepped back from the table, his gloves covered in blood that wasn't clotting anymore. 14 hours. They'd been inside her chest cavity for 14 hours, and the tumor wrapped around her heart like a python strangling its prey still had them beat. The anesthesiologist looked at him with that expression. The one that said, "Call it. It's over. You did everything you could." But something made him reach for the scalpel again. Something he couldn't name. Not hope. Hope had died around hour 11. Not stubbornness, though God knows he had plenty of that. It was something deeper. A refusal encoded in his DNA, in every year of medical school, every residency shift, every patient he'd lost and everyone he'd saved. A refusal to let a 23-year-old woman die on his table when there was still one more thing to try. Even if that one more thing was impossible. The girl who shouldn't have lived. Sarah Mitchell was 23 years old when the headaches started. Not the kind you take aspirin for and forget about. Not even the kind that make you call in sick to work. These were the kind that made her pull over on the highway because she couldn't remember where she was going. The kind that made her vomit in grocery store parking lots while strangers asked if she needed an ambulance. The kind that made her forget her mother's name mid-sentence, then remember it with such crystal clarity that the forgetting seemed like a nightmare she'd imagined. Migraines, the first doctor said, scribbling a prescription for sumatriptan. Stress, said the second, recommending yoga and meditation. Have you considered seeing a therapist? Asked the third, with that particular tone that made Sarah want to scream. She wasn't crazy. She knew something was wrong. You don't forget your mother's name because you're stressed. You don't lose vision in your left eye for 30 seconds because you need to do more downward dog. 3 months of misdiagnosis. 3 months of being dismissed, patronized, told that women her age tend to be dramatic about pain. 3 months of deterioration so gradual she didn't realize how bad things had gotten until she woke up one morning and couldn't feel her left arm. That's when her mother dragged her to the ER. The CT scan lit up like a Christmas tree from hell. The radiologist who first saw the images actually said, "Oh my God!" out loud, a violation of every professional protocol, but understandable under the circumstances. He called in his supervisor. The supervisor called in the head of radiology. Within an hour, 6 doctors were crowded around a computer screen, staring at an image that shouldn't exist. The tumor was the size of a grapefruit, and it had grown around Sarah Mitchell's heart. Not near it. Not pressing against it. Not sitting adjacent to cardiac tissue like a dangerous neighbor. It had entwined itself with the organ wrapped around the left ventricle, the right atrium, both coronary arteries. The imaging showed tendrils of malignant tissue threaded through healthy heart muscle like roots growing through cracked pavement. Like a parasite that had found the perfect host. One wrong cut and she'd bleed out in 90 seconds. One right cut, and there might not be enough heart left to keep her alive. The impossible diagnosis. Dr. Patricia Holbrook was the first surgeon they consulted. She was a legend in cardiothoracic surgery, 30 years of experience, over 2,000 successful operations, a published researcher whose techniques were taught in medical schools worldwide. If anyone could look at Sarah Mitchell's scans and find a pathway forward, it would be her. She studied the images for 45 minutes. Then she looked at Sarah's parents and said, "I'm sorry. It's inoperable. Not difficult. Not risky. Inoperable. There has to be something." Sarah's father started. "The tumor has fused with the cardiac muscle at a cellular level," Dr. Holbrook explained, her voice gentle but firm. "To remove it, we'd have to remove significant portions of her heart. She wouldn't survive the operation. I'm truly sorry." The second opinion came from Dr. Raymond Torres at Johns Hopkins. Same conclusion. "Maybe 6 weeks," he told them. "We can make her comfortable." The third surgeon, Dr. Elena Petrov at Mayo Clinic, didn't even take the meeting. Her assistant sent an email. After reviewing the imaging, Dr. Petrov has determined she cannot provide surgical intervention for this case. Cannot. Not. Will not. Cannot. Sarah Mitchell had been handed a death sentence by the best cardiac surgeons in the country. That's when someone mentioned Dr. Marcus Chen, the maverick. Marcus Chen had a reputation. Not the good kind that gets you keynote speeches at conferences. The kind that gets whispered about in hospital cafeterias. The kind that makes other surgeons shake their heads and say, "That crazy bastard," with a mixture of admiration and concern. He took cases no one else would touch. Performed procedures that existed only in theoretical journals. He'd successfully separated conjoined twins when 4 other surgical teams had refused. He'd removed a tumor from a patient's brain stem that 3 neurosurgeons had declared a death sentence. He'd reattached a hand that had been severed for 11 hours, 6 hours past the point where reattachment was supposed to be possible. He succeeded more often than he failed. But when he failed spectacularly. A year before Sarah Mitchell showed up in his office, Chen had lost a patient during an experimental cardiac procedure. The patient had signed all the waivers, understood all the risks, had maybe 3 months to live anyway. But when you lose someone on your table, when you're the one holding the scalpel, when the monitor goes flat, it doesn't matter that they were dying anyway. It doesn't matter that you were their last hope. It matters that they're dead and you're not. Chen had been cleared by the medical board. The hospital's ethics committee found no wrongdoing. But he'd still been required to undergo a psychiatric evaluation. Still had to sit across from a therapist and explain that no, he wasn't reckless. Yes, he understood boundaries. No, he didn't have a god complex. The therapist had cleared him. Barely. You have a tendency to see possibilities where others see limitations, the report said. This makes you either brilliant or dangerous. Sometimes both. When Sarah Mitchell's scans landed on Chen's desk, he stared at them for 3 days straight. He brought them home. Studied them over dinner. Woke up at 3 in the morning and pulled them up on his tablet, tracing the tumor's pathways with his finger on the screen. His wife, an ER physician who understood obsession because she'd seen it in herself, brought him coffee and didn't ask questions. On the 4th day, Chen called Sarah Mitchell's mother. "I think I can do it," he said. There was a long silence on the other end of the line. Everyone else said, "I know what everyone else said. I'm telling you what I think. I can't promise she'll survive. But I can promise that if we don't try, she definitely won't." Another silence. "What are her chances?" Chen had calculated this. Run the numbers 100 different ways. Best case scenario, worst case scenario, everything in between. But sitting there in his office with surgical atlases scattered across his desk and Sarah Mitchell's death sentence glowing on his computer screen, he told the truth. "I don't know. This surgery has never been done before." "Never?" "Never. We'd be the first." He heard Sarah's mother take a shaking breath. Can we think about it?" "Of course. Take your time. I'll be here." She called back 6 hours later. "Sarah wants to live," she said simply. "Whatever it takes." Preparation. The hospital board required a meeting. Chen presented his surgical plan to a room full of administrators, attending physicians, and legal counsel. He walked them through every step: the incision, the bypass, the careful dissection of tumor from heart tissue. He showed them the imaging from every angle. He presented research on similar cases, though none were truly similar. He answered every question with precision and confidence. When he finished, the hospital's chief of surgery leaned back in his chair. "Marcus, this is insane. It's the only option. The only option is palliative care. Making her comfortable. This," he gestured at the surgical plan. "This is how you lose your medical license. Only if she dies. She's going to die, Marcus. If not on your table, then 6 weeks from now. The outcome is the same." Chen stood up. "The outcome is not the same. One way, she dies having tried. Having fought. Having given herself a chance. The other way, she dies in a hospice bed, knowing we gave up on her. We didn't give up. We evaluated the situation realistically. She's 23 years old. The room went quiet. Chen continued, his voice steady. She's 23. She should be worrying about student loans and bad dates, and which Netflix show to binge. Instead, she's writing goodbye letters to her parents. So yes, the surgery is risky. Yes, I might fail. But I'm going to try because that's what we do. We try. The chief of surgery looked at him for a long moment. Then at the rest of the board. All in favor of approving this surgery? 3 hands went up. Opposed? 4 hands. The chief of surgery sighed. Motion fails. I'm sorry, Marcus. Chen nodded slowly, gathered his materials, walked to the door. Then he turned back. I'm doing it anyway. Marcus. She's consented. Her family's consented. I've disclosed every risk. You can fire me after, but I'm not going to let that girl die without trying. He left the room before anyone could respond. The surgery was scheduled for 3 days later. The night before, Sarah Mitchell couldn't sleep. She lay in her hospital bed, staring at the ceiling, tracing the cracks in the acoustic tiles. Somewhere down the hall, a patient was moaning. An 4 pump was beeping. Normal hospital sounds. The soundtrack to the last night of her life. Maybe. Probably. Her mother was asleep in the chair next to the bed, her head at an uncomfortable angle, soft snores escaping her open mouth. Her father had gone home to shower and feed the dog, normal tasks that felt absurd under the circumstances. Her younger brother had visited earlier, trying to be strong, trying not to cry, failing at both. Sarah wasn't scared. She'd been scared 3 months ago when the headaches started. Scared when doctors kept dismissing her. Scared when she saw the CT scan and understood, even before anyone explained, that something was very wrong. But now she just felt tired. Tired of being poked and prodded. Tired of pitying looks. Tired of being the girl with the inoperable tumor, the medical impossibility, the tragic case that doctors discussed in conference rooms with sad head shakes. If she died tomorrow or today, technically, since it was past midnight, at least she'd have tried. At least Dr. Chen had believed it was possible. That counted for something. The door opened quietly. Sarah turned her head, expecting a nurse with medication. It was Dr. Chen. He wore jeans and a sweatshirt instead of his usual surgical scrubs or dress clothes. He looked human. Tired. Real. Couldn't sleep either? Sarah asked. Chen smiled slightly. Never can the night before a big surgery. You do this a lot? Define this. Impossible surgeries. He pulled up a chair, sitting where he could see her face. I do a lot of difficult surgeries. But impossible? This is the first one I've called that. Sarah appreciated the honesty. Are you scared? Terrified. Good. That makes 2 of us. They sat in comfortable silence for a moment. The 4 pump continued its rhythm. Her mother snored softly. Can I ask you something? Sarah said. Anything. Why are you doing this? Really? Everyone else said no. You could have said no too. You'd have been right medically, legally, all of it. So why? Chen was quiet for a long time. Long enough that Sarah thought he might not answer. Then, 5 years ago, my daughter had pneumonia. Bad case. She was in the ICU, on a ventilator. The doctors told us to prepare for the worst. They said her lungs were too damaged, that even if she survived, she'd need a transplant. They were giving up. But one doctor, this crusty old intensivist who should have retired a decade earlier, said, let's try one more thing. Changed her antibiotic regimen. Adjusted the ventilator settings. Basically went against every other doctor's recommendation. And it worked. She was off the ventilator in 3 days. Out of the hospital in 2 weeks. She's 10 now. Plays soccer. Never had a transplant. That crusty old doctor gave me my daughter back. Sarah felt tears welling up. So you're paying it forward. I'm trying to be the doctor who tries one more thing, even when it seems impossible. He stood up, squeezing her hand briefly. Get some rest, Sarah. We have a long day tomorrow. Dr. Chen? Yeah? Thank you. He nodded and left. Sarah Mitchell closed her eyes and finally slept. The 14-hour descent. The operation began at 6:47 a.m. The ore was cold kept at 62 degrees to minimize bleeding, to slow metabolism, to give them every possible advantage. The surgical team consisted of 7 people: Dr. Chen, 2 surgical residents, an anesthesiologist, a cardiac perfusionist, a scrub nurse, and a circulating nurse. Everyone knew this was unprecedented. Everyone knew the odds. Sarah Mitchell was put under at 6:52 a.m. The anesthesiologist Dr. David Park, who had worked with Chen for 8 years, used a cocktail of drugs designed to keep her heart rate low, her blood pressure stable, her body as calm as possible for the trauma ahead. Chen made the first incision at 7:03 a.m. Sternum to navel. The chest is opened with a sternal saw, brutal but necessary violence. Ribs cracked apart. The pericardium, the sac around the heart, exposed. And there it was. The tumor. In imaging, it had looked bad. In reality, it looked apocalyptic. The mass was mottled purple and red, with thick vascular bundles feeding it like roots drawing from the heart itself. It wasn't just wrapped around the organ, it was integrated. Threads of tumor tissue disappeared into healthy muscle. The boundaries were indistinct, horrifying. Jesus, one of the residents whispered. Chen said nothing. He'd seen the scans. He'd known it would be bad. But knowing and seeing are different animals. All right, he said, his voice steady. Let's get to work. The first 2 hours were spent mapping, identifying which parts of the tumor could be safely separated, which parts would require cardiac muscle removal, which parts might kill Sarah if touched wrong. Chen worked with precision that bordered on obsessive, marking tissue with tiny sutures, creating a roadmap for the dissection ahead. At 9:15 a.m., they knew they were in trouble. The tumor wasn't just fused to the heart, it had infiltrated the left ventricle wall. Removing it would mean removing part of the chamber itself. Chen would have to reconstruct cardiac muscle on the fly. We need to bypass, he said. They put Sarah on cardiopulmonary bypass at 10:03 a.m. 2 large tubes inserted into her major vessels, routing blood outside her body through a machine that would oxygenate it and pump it back in. Essentially, her heart and lungs would stop working. The machine would breathe for her, pump for her, keep her alive while they dissected the thing killing her from the inside of her most vital organ. Her heart slowed. Stopped. The bypass machine took over with a rhythmic mechanical hum. And Dr. Marcus Chen started cutting. Continuing in next part due to length. For the next 4 hours, Chen worked in millimeters. Every cut was a negotiation with death. Too shallow, and the tumor would remain. Too deep, and he'd pierce the heart wall. The margin for error was measured in fractions of millimeters. The ore was silent except for the mechanical breathing and the steady beep of monitors. Every few minutes, someone would call out numbers: blood pressure, oxygen saturation, core temperature, bypass flow rate. A medical liturgy recited over the body of a dying girl. The tumor tissue was dense, angry, vascular. It bled from surfaces that shouldn't bleed. Every time Chen cut away a section, 2 more attachments revealed themselves, hydra-headed, endless. His hands, rock solid for a decade of surgeries, started to shake at hour 6. He paused. Flexed his fingers. The tremor was barely visible, but in microsurgery, barely visible might as well be an earthquake. You okay? Dr. Park asked from behind the anesthesia curtain. Fine. Just need a second. Chen closed his eyes. Breathed. Opened them again. The tremor was gone. He kept cutting. At 2:47 p.m., 7 hours and 44 minutes into the surgery, the first flatline. Sarah Mitchell's heart stopped. Not the controlled stop of the bypass. not a planned intervention. Her heart, stressed beyond endurance, traumatized by hours of cutting, simply gave up. Complete electrical silence. Asystole? The bypass machine was still running, still keeping her blood oxygenated, still pushing it through her body. But her heart was dead. Paddles, Chen said, his voice sharp. The defibrillator charged. 200 joules. The shock made Sarah's body arch on the table. Nothing. Again. Nothing. 300. Nothing. Chen pressed his hands against her heart, or what was left of it, and began manual compressions. Squeezing the organ directly, forcing it to move, to contract, to remember what it was supposed to do. 30 seconds. 45. A minute. On the fourth shock, a rhythm appeared. Weak, irregular, barely a whisper on the monitor. But there. Chen exhaled. He hadn't realized he'd been holding his breath. We're good. Keep going. They kept cutting. The second death. By 5 p.m., Chen's back was screaming. He'd been standing in the same position for over 10 hours, bent over an open chest, performing microsurgery on tissue that seemed determined to kill his patient. His feet were numb. His shoulders burned. His hands, still steady, still precise, felt like they belonged to someone else. The team was rotating out. Fresh nurses every 4 hours. A new anesthesiologist at hour 8. The residents swapped positions, taking breaks to eat, to use the bathroom, to remember what the world outside this or looked like. But Chen stayed. He couldn't leave. Not when he could see the pathway now, could trace the final separations in his mind. Just a few more centimeters. Just a few more hours. At 6:23 p.m., Sarah died again. This time, it wasn't a gradual decline. It was catastrophic. Her heart didn't just stop, it seized. Every muscle fiber contracting at once, a massive spasm that twisted the organ in her chest cavity. The bypass machine alarm shrieked. The monitor showed a rhythm that shouldn't exist, wide, bizarre complexes that looked like something from a horror movie. Ventricular fibrillation, Dr. Park announced, unnecessary because everyone could see it. AP. Atropine. Charge to 200, Chen said, his hands already moving. They shocked her. Nothing. 300. The rhythm worsened. Chen abandoned the scalpel and put his hands directly on her heart, feeling the chaotic quivering under his palms. He injected magnesium sulfate directly into the cardiac muscle. Poured LD saline over the organ, trying to slow the electrical chaos, reset the system. Manual massage. Firm, rhythmic squeezes. For 8 minutes, an eternity, in a code situation he worked. His hands moved on autopsy. On muscle memory. On 10,000 hours of training and practice and life or death decisions. At 6:31 p.m., a rhythm returned. Weak. Thready. Unstable. But there. Chen stepped back, looking at the monitor. At the heart that had been dead and was now, technically, alive. We need to close, the chief resident said quietly. Dr. Chen, we need to stop. No. She can't take much more. Neither can the tumor. Chen pointed with a blood-soaked instrument. Look. We're through the worst of it. We've removed 80%. Another 90 minutes and we're out. She might not have 90 minutes. Chen looked at the monitor. At the heart that was barely beating. At the girl who had trusted him. At the promise he'd made to himself 5 years ago, when his daughter was dying and someone had said, "Let's try one more thing. Then we work fast." The third time. Imagine being in that room. The smell of cauterized flesh mixing with the metallic tang of blood. The temperature kept brutally cold, so cold that everyone's breath would be visible if they weren't wearing masks. The steady mechanical rhythm of the bypass pump. The weight of knowing that a 23-year-old woman's entire existence depends on the next movement of your hands. Would you keep cutting? Would you have the arrogance or the faith, or the insanity to believe you could succeed where biology itself seemed determined to fail? At 7:51 p.m., Sarah coded for the third time. Chen didn't even look up from the surgical field. AP. Atropine. Charged to 200. They shocked her back. It took one attempt, this time some small mercy, but when her heart restarted, it was barely a whisper. The waveform looked like something drawn by a dying seismograph. Blood? Chen asked. She's had 18 units. Dr. Chen, we're going to run out of her type. Get more. Marcus. Get more. They transfused her with 23 units of blood that night. Nearly twice her total blood volume. Her body was consuming clotting factors faster than they could replace them. Her temperature had dropped to 94 degrees despite warming blankets. Her kidneys were starting to fail from the sheer trauma of being kept alive by machines for so long. But the tumor was coming out. Millimeter by millimeter, Chen separated it. He worked with magnification glasses now, the surgical field enlarged to where he could see individual cells. Every movement precise, controlled, desperate. At 8:47 p.m., he finally cut the last major attachment, a thick band of tissue connecting the mass to the left coronary artery. The most dangerous cut of the entire procedure. If he nicked the artery, she'd bleed out in seconds. The scalpel moved. Clean separation. No bleeding. Chen almost laughed. At 9:03 p.m., he removed the final connection to the right atrium. The tumor came free. He held it in his hands, this malignant, monstrous thing that had nearly killed a girl who should have had her whole life ahead of her. It was heavier than he expected. Dense. Ugly. Alien. He dropped it into the specimen tray with more force than necessary. And turned back to the heart. Which wasn't beating. The final death. 9:47 p.m. 13 hours and 4 minutes since the first incision. The monitors showed a flat line. Not fibrillation this time. Not a chaotic rhythm that could be shocked. Just nothing. Electrical silence. The heart freed from the tumor but ravaged by 13 hours of surgery, 3 cardiac arrests, massive blood loss, and trauma that would have killed most people in the first hour had given up. The bypass machine was still running. Still oxygenating blood. Still pushing it through Sarah Mitchell's body, keeping her brain alive, keeping her organs perfused. But her heart, the organ they'd spent 14 hours trying to save, was dead. AP, Chen said. His voice was hoarse now. He'd barely spoken above a whisper for hours. Direct injection. They pushed epinephrine directly into the heart muscle. Nothing. Again. Nothing. Chen picked up the paddles himself. Everyone clear. The shock made her body arch violently on the table. The monitor stayed flat. Again. Flat. Again. Flat. Chen looked at the clock. 9:53 p.m. Looked at the heart, torn, stitched, traumatized almost beyond recognition. Looked at his team, who were looking at him with exhausted, sympathetic faces that said, "You tried, you did everything possible, you can let go now." The anesthesiologist Dr. Park, who'd seen Chen pull off impossible saves before, said quietly, "Marcus. She's gone." Chen's hands were still on the paddles. Still ready to shock again. Still unwilling to accept what everyone else in the room had already accepted. "Marcus. It's over." And Dr. Marcus Chen, who had operated for 13 hours without rest, who had brought a patient back from death 3 times, who had done the impossible and found it wasn't enough, finally nodded. Time of death, 9:54 p.m. He set down the paddles. Pulled off his gloves. Each motion slow, mechanical. The gloves fell into the biohazard bin with a wet slap. He walked to the wall. Put his forehead against the cool tile. The ore started winding down. Someone began cleaning. Someone else prepared the paperwork. The awful, inevitable deflation that happens when a battle is lost. Chen stood against the wall for 30 seconds. Maybe 40. And then he heard it. The impossible pulse. Beep. Just one. Chen's head snapped up so fast his neck cracked. Beep. 2. He was across the room in 3 strides, staring at the monitor. at the single, fragile waveform that had appeared on the screen like a message from another universe. Beep. She's Dr. Park couldn't finish the sentence. Couldn't articulate what he was seeing because it was impossible. Beep. 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 Sarah Mitchell's heart was beating. Not well. Not strongly. But beating. On its own. Without medication. Without shocking. Without any intervention whatsoever. As if her heart had needed those 60 seconds of true death to rest. To recover. To gather whatever strength remained in traumatized muscle cells and damaged tissue and decide, on its own, to try again. The ore exploded into action. Medications to support the rhythm. Careful monitoring. Hands moving with practiced precision, but everyone's eyes kept darting to the monitor. Watching the waveform. Waiting for it to fail again. It didn't. Slowly the rhythm strengthened. 60 beats per minute. 65. 70. Blood pressure is coming up, someone said, voice filled with disbelief. Oxygen saturation holding steady. Cardiac output improving. Chen stood there, hands at his sides, watching Sarah Mitchell's heart remember how to be alive. At 10:03 p.m., they started closing her chest. At 11:47 p.m., Sarah Mitchell was wheeled into ICU with a heartbeat of 72 and a blood pressure of 110/70. Alive. The recovery. She shouldn't have woken up. The medical literature was clear on this. The trauma to her system, the blood loss, the time on bypass, the 4 cardiac arrests, the hypothermia, the metabolic chaos should have left her brain damaged at best. Vegetative at worst. The ICU team prepared her parents for the possibility that even if Sarah survived, she might never be Sarah again. She opened her eyes 36 hours later. "Where's my mom?" were her first words. Clear. Coherent. Completely herself. The ICU nurse actually started crying. Within a week, Sarah was sitting up. Within 2 weeks, walking with assistance. Within a month, the neurological tests showed 0 deficits. Her memory was intact. Her cognition normal. Her personality unchanged. And her heart scarred, stitched, reconstructed, held together by surgical miracles and sheer stubbornness was pumping at 80% capacity. "It's impossible," the cardiologist said, staring at her echocardiogram. "The amount of damage that organ sustained. There's no way it should work this well." "But it does," Sarah said from her hospital bed. "But it does." The tumor pathology came back. Fibrosarcoma, grade 4. Aggressive. Malignant. The kind that kills quickly and mercilessly. Complete removal. Clean margins. 0 residual disease. 3 months after the surgery, Sarah Mitchell walked out of the hospital. Not in a wheelchair. Not with a walker. She walked on her own 2 feet, carrying her own bag, wearing a t-shirt that said, "I died 4 times and all I got was this lousy scar." Dr. Chen met her at the entrance. He'd rehearsed what to say. Something professional. Humble. Appropriate for a physician saying goodbye to a patient. But standing there, looking at this young woman who should have been dead, who had been dead, he found he couldn't speak. So he just hugged her. And for the first time in 14 years of surgical practice, Dr. Marcus Chen cried. The aftermath? That was 7 years ago. Sarah Mitchell is 30 years old now. She's married, met her husband in a coffee shop 2 years after the surgery, told him about her scar on their 3rd date. He said it was the most beautiful thing he'd ever seen. She works as a nurse in a pediatric ICU. She sees children fighting for their lives, sees parents with that terrible expression of helpless love, and she understands in a way most people can't. She runs half marathons. Her heart, the one that stopped 4 times, the one that had a tumor wrapped around it like a death sentence, the one that shouldn't work, beats strong and steady. 72 at rest. 140 when she runs. She has a scar from sternum to navel. 16 inches of raised tissue where her chest was cracked open. where hands reached inside and pulled her back from death. 4 times. She traces it sometimes. In the shower. Getting dressed. Lying in bed next to her husband. Feeling the ridge of tissue. Remembering what it cost to still be here. Dr. Chen doesn't talk about the surgery much. When other surgeons ask, and they do, because the case was published in 3 major medical journals, because it's taught in medical schools now as an example of the limits of possibility, he deflects. Team effort, he says. Lucky timing. She's strong. She did the hard part. But late at night, when he can't sleep, he thinks about that 4th flat line. About the moment he called time of death. About walking to the wall, defeated, ready to accept failure. About the impossible pulse that came back. He's performed thousands of surgeries since then. Saved hundreds of lives. Had successes and failures, triumphs and tragedies. But he's never forgotten the girl who died 4 times. And lived anyway. Last year, Sarah Mitchell had a baby. A healthy 7-pound girl with her mother's eyes and her father's chin. The pregnancy had been risky. Carrying a child puts enormous strain on the heart, but Sarah's cardiologist had cleared her. Monitored her carefully. Held his breath for 9 months. Dr. Chen got the birth announcement in the mail. Emma Grace Mitchell. Born 3/15. 7 pounds 2 ounces. And underneath, in Sarah's handwriting, "Thank you for my life. Now thank you for hers too." Chen put the announcement on his refrigerator. It's still there. The question that remains. What would you have done? In that moment at 9:54 p.m., when every indicator said stop. When your body was screaming for rest. When the rational part of your brain knew it was over. When you'd been standing for 13 hours. When you'd brought her back 3 times already. When everyone else in the room had accepted the inevitable, would you have found it in yourself to take one more breath? To stand at that wall for 30 more seconds? Would you have heard the pulse? Dr. Chen still doesn't know if he made the right call. He violated protocols. Ignored colleagues. Operated beyond the point of medical rationality. He risked his license, his reputation, his career. If Sarah had died, stayed dead after that 4th arrest, he'd have been destroyed. Professionally, legally, emotionally. But she didn't die. She lived. And that changes everything. Or does it? In quiet moments, Chen wonders if he was lucky or skilled. If the surgery succeeded because of what he did, or in spite of it. If Sarah's heart restarted because he'd done something right, or simply because biology is stranger than we understand. He'll never know. Sarah Mitchell sends him a Christmas card every year. Always with a photo. First year, Sarah at home, smiling. Second year, Sarah running a 5K. Third year, Sarah at her wedding. Fourth year, Sarah holding baby Emma. This year's card shows Emma taking her first steps. On the back, Sarah wrote, "She's walking because I'm alive. I'm alive because you refuse to give up. Thank you will never be enough, but thank you." Dr. Chen keeps these cards in his office. A reminder. Not of success, he's had plenty of successful surgeries. But of the moment when success seemed impossible, and he tried anyway. Epilogue: The tumor. The tumor sits in a pathology lab somewhere. Specimen M2018-4472, cardiac fibrosarcoma, grade 4. Preserved in formaldehyde. Contained in a clear jar on a shelf with hundreds of other specimens, tissue samples and tumors and fragments of diseases that were cut out of living people. No one looks at it anymore. The pathologists did their analysis years ago. Documented the cell structure, the malignancy grade, the invasion patterns. Published their findings. Moved on to the next specimen. But it's there. This thing that nearly killed Sarah Mitchell. This impossible malignancy that grew where tumors shouldn't grow, that entwined itself with the most vital organ in her body, that 3 surgeons had declared a death sentence. It looks small in the jar. Ugly. Dead. The heart it tried to kill is beating in a woman who's planning to have a second child. Medicine doesn't always make sense. Sometimes outcomes defy every prediction. Sometimes patients survive when they shouldn't. Sometimes a heart that stops 4 times decides, for reasons no one understands, to beat again. And sometimes, the impossible is just stubbornness with a scalpel. Dr. Marcus Chen is 52 now. Still performing surgeries. Still taking cases other surgeons won't touch. Still pushing boundaries, testing limits, trying one more thing when everyone else has given up. His colleagues still call him crazy. He still doesn't care. Because somewhere in America, a 7-year-old girl named Emma Mitchell is learning to ride a bike. And her mother, who should have died 7 years ago, who was dead for 60 seconds on an operating table, is running beside her, one hand steadying the seat, the other over her heart. Feeling it beat. Strong and steady. Alive.